My name is Amanda Hood, and I'm a licensed marriage and family therapist practicing in Macon, Georgia. I've been doing a lot of thinking about this coronavirus, and I know everyone has as well, as if it's not hard enough to deal with a cancer diagnosis and all the appointments and life disruptions that entails. Now we are in the midst of a global pandemic. I have history working in a clinical setting where I worked with patients with chronic illness and really helped them deal with some of the depression and anxiety that can sometimes accompany chronic illness, being sick, being cooped up. And a lot of that mimics what we're seeing right now with COVID-19. Not only that, I think we have on top of that just the fact that everyone in our lives is experiencing that. So it's not just, hey, it's me with a cancer diagnosis over here, or it's me struggling with diabetes over here, but it's everyone. And so that can kind of complicate things. And so I guess what I'm saying is I know that this is an especially tough time for those dealing with cancer, even those in remission, on the path to recovery, now cannot resume their normal lives as quickly as they once thought. We're facing new challenges. Social distancing, that's a term that we are all too familiar with at this point, and for good reason, especially those who have health concerns or who are currently or even in the recent past have dealt with cancer. We all know that cancer treatments weaken the body's immune system, and that even as those treatments are passed, we can continue to see a suppressed immune system long after. So on a rational level, we can make sense that all this social distancing is very important. We know that we've got our responsibility to flatten the curve and also to keep those that we love and ourselves safe. But even rationally, we can think that, and on a very practical level and one that we feel, why is the act of social distancing so hard for so many of us? And there's a lot of reasons for that. The answer probably has more to do with our evolutionary history than one might think or acknowledge in our everyday lives. We are mammals at the end of the day, and we don't really think of ourselves as such a lot of the time, but human beings are part of a very sociable group known as the primates. How are primates distinguished? They are distinguished from other animals in many ways, both from from grasping hands and moving around, but also because they have developed high levels of social interaction. Although there's been no time currently to study the effects of social distancing related specifically to the coronavirus to human beings, primates, we do know a great deal about the impact of social isolation on both mental and physical health. It's often experienced as highly stressful. I think we can all attest to that right now. I know I'm seeing a lot of that in my own life, but also in the people that I talk to every day in my telehealth practice. Well, my practice has now moved to telehealth because of social distancing. And I'm talking to people about the increase in stress that they feel just from the uncertainty of the times. But we do know that social isolation, while it has a great deal of impact on mental and physical health, in that it can be highly stressful and the stress can become toxic, isolation, particularly loneliness, increases the risk of both anxiety and depression. So when we know that social isolation has these negative effects, in fact, some data suggests that social isolation has the equivalent adverse impact on physical health to smoking 15 cigarettes a day. It's a greater threat to our health than obesity and is linked to an increased variety of problems, health problems and mental problems. So now that we've kind of established that we're human beings, we're primates, we need a certain amount of social contact. And without it, our bodies are less healthy, our minds are less healthy, and we suffer. So now that we've kind of established that baseline, I think it's time to talk about what are some ideas of things that you can do for yourself during this time when we know that distance has to be a real part of our lives. I think first and foremost, what I'm seeing and what the evidence suggests right now is radical self-acceptance. If you've never heard of that term, it's really just about being kind to yourself. If you can do anything else, provide yourself with a soft place to land. We have a lot of really harsh news stories coming our way every day. Tensions may be high in our families. So anything that we can do to kind of lessen the impact on ourselves, maybe it's saying a kind word, accepting everything about yourself, the good, the bad, the ugly, accepting your current situation, and without blame, without question, basically accepting the fact that there is no roadmap for this. And so without a roadmap, we have to assume that we're all only doing the best that we can. And so we are looking at our lives and saying, okay, here I am. I've got to accept that this situation is something that I cannot change. And I'm going to do my best. I'm going to do my best to deal with it the way that I can. And if I fail, okay, I fail, and I'm going to get up and I'm going to dust my knees off and I'm going to try again tomorrow. So I think that's probably what I would recommend first. Another thing that we have that people in other times, I know the Spanish flu pandemic around 1918 occurred and people didn't have social media. You can go back and forth about if social media is a good thing or a bad thing. It is a way that technology allows us to be closer to those that we love when we cannot physically be present with them. So that is another way that we can kind of increase our circle. And it doesn't necessarily have to be social media. It doesn't necessarily have to be through Facebook or Instagram or whatever platform you choose to use. But it can also be just taking advantage of technology like our cell phones. It can be FaceTiming with grandchildren or friends. It can be getting into groups of people that you may connect with. I know I've been doing a lot of Zoom meetings. There are also all kinds of groups you can get into for things that you're interested in. I've seen a sourdough group because people have been baking more during the pandemic, or a hand embroidery group for people that sew. But it gives us a chance to just have some of that interaction. And so I think taking advantage of the advances in technology is great during this time. And like I said, it doesn't necessarily have to be social media, but social media can be a good way as well. Another is just to kind of cultivate your community. So if that is that you belong to a church, seeing if somehow there can still be a Bible study that you could get involved in, or a book club where maybe it's not a physical meeting, but it's something that gives you some purpose and some meaning. And then you check back in with one another every now and then. But humans need a sense of community. We need to feel like we belong. And just because we're stuck in the house doesn't necessarily mean that we have to give that up. So there are some avenues out there that we can still continue to feel a sense of community. And then another way is to kind of deepen or broaden the relationships that we already have. Maybe there's a friend that you haven't been able to talk to as much recently. You haven't had time to be able to pick up the phone and give that person a call, or to spend more intentional time with, if there are some people that are in your lives that, you don't really take the time to sit down and have a deeper conversation with. Sometimes just looking at what we already have and making an intentional effort to deepen or broaden that can just give us a little bit of a firmer foundation in terms of our social lives. And one easy tip that I wanted to sneak in here, and I'm almost done, is to really think about it in terms of dressing for the social life you have. I think a lot of what this pandemic and social distancing has done is kind of forced us inside. And even if we're not inside all the time, we're hanging out on our patio or in our backyard and we're not really having to see anyone. And so a lot of us will go days without really getting dressed. And that can have kind of a long-term impact on just the general way that we feel about ourselves, the way that we see ourselves. So a lot of times I recommend, dress for the social life you want, not the one that you have. Maybe get up and put on a pair of jeans instead of your stretchy pants, and put on some makeup or put on a hat, and then take a walk around the yard or get out of the house and just get some fresh air any way you can. Open the windows, just something to get some vitamin D and sunlight and fresh air. And I'm seeing that helps me a lot. So I hope that these tips help you as well. I'm hoping to maybe be able to add some more self-care tips to them, because I think that's really important in the current atmosphere that we are in. There's a lot of uncertainty. We don't really know how long this will last. We have snippets of hope every now and then. But I think it's important too to be able to accept where we are and be content with that. So maybe, to kind of summarize all of this, a good reframe might be that we start to refer to this period as physical distancing and not so much social distancing, because I think physical distancing is a lot of what is truly going on here. I think if we put some creativity to it and put our minds to it, we don't necessarily have to be alone through this. And so it is my wish for you that you can remember to take care of yourself, to be kind to yourself, and to stay well through all of this. And I look forward to talking to you again soon. Thanks.